I wasn't feeling right. My health deteriorated quickly, very quickly. So I called Whitney and I made an appointment and said, hey, look, I want to come in and see what's going on.
He was having problems with sleeping, just not feeling well, waking up feeling short of breath.
And she said, I need you to go to the emergency room. I'd never heard anyone in the medical industry speak to me in a way that had the compassion that followed with what she was saying. And she said, please go to the doctor now.
I think sometimes when patients are living with homelessness or just uninsured, that's a really big ask to send someone to the emergency room. That's a lot of money that can really sort of derail someone if they're not ready or don't want to go.
I was dying. And had it not been for Whitney convincing me to go to the hospital that day, I would have died. And I would have just been another statistic.
We take care of everyone who walks in our doors. I think Health Partnership Clinic is unique because it really is bringing the community together to provide healing and hope to those who need it.
About 90% of our patients are at 200% of federal poverty level or below, and so we are one of the very few healthcare organizations that's able to step up and help these patients who might not have insurance or might be underinsured.
We provide medical, dental, behavioral health, and substance use disorder treatment to over 10,000 individual patients each year. Currently today, we have sites in Olathe, Shawnee Mission West High School, and then in Ottawa and Paola, Kansas.
Health Partnership Clinic provides access to patients that might not otherwise be able to access care. Not only do they get visits with their primary care providers for an affordable cost, but they can access labs, imaging, medications for less out-of-pocket expense.
As a pediatrician, one of the things I really love about HPC is our ability to take care of children who don't have insurance. So they are able to come to our walk-in clinic. We give vaccines, we do needed blood work, we can help them access low-cost medications, we connect them to community partners for other needs they may have.
When we did our community needs assessment a few years ago, one thing that kept coming up over and over was access to prenatal care in all of our communities. We came together with a new partner, the Kansas City Women's Clinic and HCA Overland Park Regional, to help us provide OB care to those patients in need. It's education and support services, dental exams, behavioral health. What can we do to provide hope to that new family, that new mom, to support them during this journey?
The Mobile Integrated Healthcare Team is a three-way partnership between the Olathe Fire Department, Health Partnership Clinic, and Olathe Health. And we're a two-person team, and we just try to provide care to people that need it most that might not otherwise be able to access. So any care that a patient can receive within the walls of HPC, we can provide in their living room, on the street, wherever it is that they need to access care, and mitigate things like ER and 911 use.
Two other programs we're involved in revolve around hypertension and diabetes. With hypertension, we were very fortunate to receive a grant where we could provide our patients with remote monitoring devices so we could really track their blood pressures, but then provide them with the tools to be successful in lowering their blood pressure.
So it's really important to measure your blood pressure, know what it is, understand how lifestyle like diet, exercise can all play a role.
With diabetes, we started a high-risk diabetes program, really looking at those patients with very high blood sugars and really focusing on them, looking at it from not only the medical but behavioral health.
So we try to spend a little bit more time talking about nutrition and the impact that those things can have for our patients, but in a way that is sustainable and attainable for them based on their particular social drivers of health and what we need to do to support that patient.
Medication management is important to the health and well-being of our patients because it alleviates their symptoms. So at Health Partnership Clinic, we really provide comprehensive behavioral health services, not only psychiatric medication management, but we have 2 licensed clinical social workers who provide integrated behavioral health visits as well as therapy, and we have a substance use counselor. Medication is not a cure-all. There is no perfect medication. I really try to stress that medication helps provide mental clarity. It gets you so far, and the rest of it is up to you.
One of the partners we work really closely with is the school system, and we work with the McKinney-Vento program in particular to help serve youth and students who are facing homelessness. We currently have a clinic at Shawnee Mission West High School where we provide medical services, we provide behavioral health services. Our dental team goes there as well. We are partnering with Community Health Council of Wyandotte County to have a community health worker here in our clinic. And that person's role is so very important because we know that so much of a patient's health happens outside of what we can provide inside a clinic wall.
We are the homeless grantee in Johnson County. As we see those numbers rise, how do we work our programming around to support homeless individuals?
If you know where to look and how to look, you will see it.
So patients that are living with homelessness have several different challenges. Transportation is a really big one, food is a really big one, accessing health care. There are some resources for patients to stay overnight. One example is the 1020 shelter. They also have a case manager that tries to help patients with those other components that can be very challenging for them. And then we try to help support those patients as well with accessing primary care services.
Like many nonprofits, we need to fill the gap between what dollars we bring in with grants or patient revenue to what our needs actually are. Health Partnership Clinic does our best and works with a very slim budget, making the most of every dollar that we get. There's a gap, particularly as Medicaid has not been expanded. We continue to do more with less. Our patients are being hit with the same things we are, inflation. How do we support them? To do that, we need the support of the communities. This allows us to grow and thrive, but also then to transfer that onto our patients and provide hope to them.
We all work together and respect each other to try to do the very best job we can for our neighbors, our patients every single day.
The clinic has helped me get to the point where my blood pressure is manageable and I was able to accept the work that would make it possible for me to feed myself and my children. It's meant everything.
I think I have impacted James's life by listening to him and treating his symptoms, being able to alleviate that anxiety so that he can use his coping skills to get through some of those hardships that he faces in life.
James is doing great today, and he continues to follow up at Health Partnership Clinic.
I'm alive, and I'm grateful for it.